that came out, and we can go through it sort of a high level, and then we could sort of chat about questions people have, and I'm happy to take things as we go as well. So I think one of the first things that came out, which I think was really important information and information we've wanted, is looking at the safety of interrupting endocrine therapy for having a pregnancy. So, this is obviously a very important question to young women who desire to have children, who have initiated endocrine therapy for their hormone receptor positive disease. It's challenging because endocrine therapy is for such a long period of time. We now tell people to take it from 5 to 10 years. And so, what do you do if you're a young patient who's being told you need 5 or 10 years of endocrine therapy and you want to have a kid? We didn't know the safety of stopping it, going on to try to conceive, and then restarting it, and how that could impact your risk of recurrence. And so this study was a huge effort by multiple cooperative groups internationally to do this, where they took patients who got 18 to 30 months of adjuvant endocrine therapy and then stopped, took a 3-week period to get the drug out of their system, and then went on to try to conceive, and looked at these patients for follow-up to see how they did in terms of their breast cancer outcomes. And so, you can see here that this study really was looking predominantly at patients who had lower stage disease, so stage 1 and 2 hormone receptor positive breast cancers, very few patients who had more, stage 3 disease. And what they did is they looked at outcomes for the patients enrolled in the study and compared it to data from the SOFT and TEXT trial. So SOFT and TEXT was a trial for young patients who were premenopausal and had, outcomes, and they matched the patients based on risk from this trial to those patients in SOFT and TEXT, and looked to compare the outcomes. And what you can see is that when you look at breast cancer events, for example, you see it's pretty much the same for the SOFT and TEXT trial as it was for these patients who did an interruption of therapy. So I think was very encouraging to see that, their risk is not higher than what we would anticipate. I think, certainly the other interesting questions that people ask is, well, how many of these patients actually went on to have a pregnancy? And it was a majority, so 3/4 of patients did. There are very few pregnancy complications. Many of these women actually went on to even breastfeed, and the majority of patients did resume their endocrine therapy. One thing I will caution about is 15% of patients still haven't resumed their hormone therapy with 4 years of follow-up, and that's what we don't want to see happen. We do want patients to be able to go on to this therapy. I think the other caveat is we only have about 4 years of follow-up, and unfortunately, risk of recurrence isn't just in the first 4 years for hormone receptor positive disease. It can be later, and so we don't have the safety of doing this with long-term data. We know with 4 years of follow-up, it doesn't seem like if there's any increased risk to the patient. And again, the caveat being this is for stage 1 and 2 patients. We don't have data with higher risk patients. So I think just to take that all into perspective, but I think very important data to know that it is safe for patients with stage 1 and 2 disease to think about an interruption, at least with this early follow-up data. And the patients will continue to be followed longer term.
That's great. Maybe just one